All right, good afternoon. Thank you all for being here today. I want to introduce a few special guests who are joining me up here. We have Dr. Robert Mayo. He is the Chief Medical Officer for Rochester Regional Health. We're joined by Dr. Michael Apostolakis, the Chief Medical Officer for the University of Rochester Medical Center. Dr. Teresa Green, the President of Monroe County's Board of Health. Wade Norwood, the CEO of Common Ground Health. We also have from the county legislature, County Legislator Mark Johns, and we also have County Legislator Rick Milne, and of course we have Dr. Mendoza, the Monroe County Public Health Commissioner. So, you know, it's funny, I thought about making this announcement on Zoom today, since all the time Mike and I have spent, Dr. Mendoza and I have spent on Zoom doing updates, but in person is so much better, and it's really great to be with these fine folks. We actually spent a lot of time on Zoom over the last year, 2 years, 2.5 years together, but it's really good that we're all together here today for this important announcement. Today I'm standing here to announce that I submitted legislation to our partners in the county legislature to reappoint Dr. Michael Mendoza to another 6-year term as Monroe County Commissioner of Public Health. It's fitting to make this announcement here at the Fleet Center, as this complex was the hub of our COVID response. This is the building, Building 11, where we ran a drive-through COVID testing and PPE storage and dispatch. One building over from here is where our vaccination clinic was held, and hundreds of thousands of doses of vaccine were delivered to our residents. But let's back up before COVID. Dr. Mendoza and I first met really just a couple weeks before I took office in January of 2020. We didn't really know each other. He was appointed by the previous administration, and I was new to my office, so we didn't know each other very well, never really had an opportunity to work together. But I knew we both shared the same common concerns. We had a concern about the opioid epidemic and how to expand our early intervention programs for children. And I think we both knew that we had to work closely to quickly build a relationship of trust if we're going to better serve our residents and keep them safe and keep them healthy. Neither of us expected that we'd have to build that relationship at light speed. It was just about a month and a half into my first term that we had our first case of COVID-19. I'm not a doctor, and I didn't want to play one on TV. But Dr. Mendoza was willing and able to stand alongside me whenever we needed to talk to the public, and we needed to explain the medical science behind any decisions that the government was making. His knowledge and expertise have been a vital asset to my administration and to this community. And he was instrumental in helping my administration forge partnerships and relationships with our major health systems, with healthcare leaders like Dr. Mayo, like Dr. Apostolakis, and Wade Norwood. With his help, we convened health systems, we convened schools, organizations, businesses, nonprofits throughout Monroe County to coordinate our community's response to this unprecedented crisis with one common goal: to mitigate the spread of COVID and ensure the health and safety of Monroe County residents to the best of our ability. We were fortunate to have the foresight and expertise of Dr. Mendoza to guide us. He helped us safely reopen businesses and get our children safely back to school and get tens of thousands of people vaccinated. In fact, under Dr. Mendoza's leadership, Monroe County administered 165,449 vaccinations against COVID-19. COVID was new and it was different, not just for me, but for both of us and this whole community. The world was shutting down, and communicating our latest understanding of what was happening had to be a priority. Our weekly COVID briefings reflected our personal discussions. We needed to follow the science. He addressed community health. I addressed government response based on the science that Dr. Mendoza was presenting. But COVID response is far from his only accomplishment. When Dr. Mendoza was named commissioner in 2016, he came in at a time when the Department of Health shouldered intense instability. There were interim commissioners, and for a time, we actually didn't even have a commissioner. The county's Department of Public Health was at times struggling. But under his leadership, the Department of Public Health has stabilized and it's grown, improving its efforts to prevent disease, promote healthy habits, and boost our quality of life. Together, Dr. Mendoza and I launched the county's Improving Addiction Coordination Team, our impact team, whose van you see behind us, to engage individuals with substance use disorder and their families, to facilitate transitions to community service providers, educate those struggling with addiction on harm reduction, and administer life-saving naloxone. We created a new role within the county to solely focus on the work to combat the substance use disorder crisis in our community. Our team is joining us here today. Their leader, Dr. Tisha Smith, works alongside Dr. Mendoza, is Monroe County's first Director of Addiction Services, and the team is here today, and we're very proud of the work you're all doing in the community. So let's give them a applause. It was really just a few weeks ago we talked about our new latest initiative, installing naloxone boxes at local businesses, gathering places around the community to save lives on the spot and get that life-saving medicine into people's hands. They're working with people to get them through. This is what Dr. Mendoza and I talked about pre-COVID. It's what we both identified as a mutual priority. Now, we have monkeypox, yet another public health crisis we're working to mitigate. And there's still the work that needs to be done on things besides pandemics and epidemics. The health department has administered 74,608 vaccinations to uninsured or underinsured individuals, including children and refugees, to prevent disease in Monroe County. The closer we work together, the more we've come to see how government and healthcare needs to evolve. Dr. Mendoza shares my philosophy to meet the people they serve where they live, not to have them come to us. He's transforming healthcare models to meet the evolving health needs of our residents. We're expanding our mobile outreach through the mobile units you see behind us today so that we can meet people where they are. We both know our residents, especially those who experience disproportionate levels of poverty, can't focus on their primary healthcare needs if they can't find their way to a doctor, or if they can't take time off from work, or if they have children at home they can't arrange child care for so they can make it to their appointments. We're taking those lessons that we learned through the pandemic and we're applying them to how we approach healthcare in Monroe County through innovation and bringing care to the people, better coordinating our healthcare systems and organizations who are the front lines of our healthcare. This is obvious to me, and it's obvious to the community. The clear choice to lead our public health efforts into the future is Dr. Mendoza, and I'm looking forward to his continued leadership as Monroe County's Commissioner of Public Health. Dr. Mendoza, Mike, it continues to be my honor to serve our residents alongside you. Where are you? There you are.
I didn't leave that.
You're not going anywhere. I can't envision a better partner to stand alongside me in advancing and enhancing the health and well-being of Monroe County residents. I consider Mike a friend. He's a colleague, and he's somebody that honestly I could not do this job without. I want to thank you, Mike, for your service and for agreeing to continue to lead Monroe County's Department of Public Health in your next 6-year term. We have a lot of work to do together, and I'm looking forward to doing it side by side. I now want to introduce Dr. Mike Apostolakis. He has been, again, an integral partner that we have had as we address the COVID-19 pandemic, as we address all of the healthcare needs in our community, bringing the healthcare systems together. He's another individual I did not know, Dr. Apostolakis. I couldn't say, there you are. I couldn't even say your name when we first started. I was messing that up at the flu thing. But we've learned, again, to work together, to grow together, to make sure that our response is coordinated. This is about tearing down silos. It's about tearing down systems to bring people together, to coordinate and to work together. And that's what I'm really proud that this group behind us has managed to do. And so with that, I'd like to invite Dr. Apostolakis to come up and say a few words.
Thank you, County Executive. I want to thank you for inviting me here today to honor Dr. Mendoza. It's been an honor to work with Mike, County Executive Bello, Dr. Mayo, Wade Norwood, my URMC colleague Teresa Green, and many others on a unified community response to the COVID pandemic. I also must thank the thousands of UR Medicine doctors, nurses, and staff members who have worked tirelessly and courageously to meet the care needs of our patients during these difficult times. To say that Mike deserves this reappointment is like saying Josh Allen deserves a shot at starting quarterback. With that in mind, I'd like to thank County Executive Sean McDermott for an excellent hiring decision. All right. Mike's efforts to help our community navigate this pandemic are too lengthy to list in detail. In the early days, the focus was on PPE and preventing our hospitals from being overrun from patients with COVID. Since then, there have been multiple surges in COVID cases, vaccines and test kits to distribute, and new treatments to make available. Through it all, Mike forged an ongoing partnership between the University of Rochester Medicine and Rochester Regional Health that enabled us to act quickly and effectively in the best interests of our community. Mike is also a great communicator. Whether the audience is healthcare workers or the general public, Mike's calm and measured demeanor, his clarity and honesty are tremendous assets. The Mike Mendoza you see on your television is the exact same person we work with behind closed doors. Always measured and reasonable, a problem solver, and a coalition builder. This is evident beyond the work with the health systems. Mike forged collaborations in education community to reopen county schools safely and keep them open. When vaccinations were approved for 5 to 11-year-olds, Mike worked with pediatricians to schedule vaccinations at county vaccination clinics. This was critical because it occurred at a time when pediatric practices were seeing a rise in cases coupled with declines in staffing. Throughout the pandemic, Mike continued to see his patients at Highland Family Medicine and around at Highland Hospital as a professor of clinical family medicine. His work as boots-on-the-ground clinician gives Mike a deep understanding of the healthcare challenges we face as a community. In my mind, one of the key takeaways of this pandemic is that having strong and collaborative public health leadership is an enormous benefit to our community, whether the challenge is COVID or monkeypox or the opioid epidemic. Thank you, Mike, for the tremendous job you're doing. We look forward to continuing our work with you and other partners to improve the health of our community. And I can tell you the one silver lining, huge silver lining of COVID for our community is the fact that public health, the county health department, Rochester Regional, and UR Medicine have a better working relationship than ever before, and it's been tremendous for our community. With that in mind, I'd like to introduce my friend and colleague, my counterpart at Rochester Regional, Rob Mayo, their CMO. Rob?
Thank you very much, Dr. Apostolakis. It's a real pleasure to be with you all here today and to enjoy a moment to reflect upon what we've accomplished, what we've been through, and also to acknowledge and favor the great recommendation of Dr. Mendoza as the next county commissioner, or as the continued county commissioner. Working with Dr. Mendoza is sort of like a real-life enactment of that children's book, you know, Where's Waldo? It's like, oh, he's over there. Oh, wait a minute, I just saw him down there. Oh, he's up here. He was everywhere. He was touching so many lives. He was a true ambassador, not only for the management of the public health needs, but just of this community. He really took to heart the needs of individuals and made personal sacrifices that are so exemplary for all of us. And I'm so appreciative for that level of committed leadership and the personal philosophy that he brings to all of us. Because of that, he really elevated all of us in our various organizations that came together in a collaborative way to support this community through the pandemic. And as Dr. Apostolakis mentioned, we fully intend for our partnership and our friendship to continue to strengthen this community and the other many challenges that we face. There's a lot of ongoing work. The opioid pandemic has been mentioned today, and there are other key priorities that we need to accomplish together, and so I'm looking forward to the ongoing community partnership. I'd also like to thank the other leaders in this community who came together and joined this partnership. Leaders like Wade Norwood and Common Ground Health invested a great deal of their resources in providing staff in many committees and community efforts. the efforts of Trillium Health and other nonprofit organizations, and then many of the individual members of this community who signed up as volunteers to help in our vaccine clinics and distribute PPE and many other activities that were vital for this community. We really have an amazing community to celebrate and to continue to foster and strengthen. So many congratulations to you, Dr. Mendoza, and my full support in your continuing appointment couldn't be firmer at this point. I'd also like to now pass the baton to the CEO of Common Ground Health, Wade Norwood, who is a great voice in this community for collaboration and makes such an indelible and important imprint on all of us.
Friends, I find that incredibly amazing that Rob Mayo just did all of that with no notes in front of himself. And I will not subject you to that type of an attempt because otherwise I talk too long. But let me just say how incredibly blessed I am. This is a pinching myself moment. As a young man who grew up off of Genesee Street in the Southwest, to be here today at the county executive's invitation to celebrate the incredible work done by Mike Mendoza and to echo the wisdom behind County Executive Bello's decision to recommend Mike Mendoza for a second 6-year term as our public health commissioner, a man who is focused on the children and the families of our community. What an awesome moment. And Adam, thank you. Friends, I have known and worked with Mike Mendoza in so many different ways. I'm a bit embarrassed that he is now the poster child for the former employees of Common Ground Health. They tend to go on to do magnificent things that clearly we aren't able to do at the agency because we can't do it alone. We need this partnership with Monroe County. And because my career began in elective office, I am super pumped by the members of the Monroe County Legislature that are here. Jim Nagel, who was one of my mentors, Jim Nagel said to me a long time ago as a Republican state assembly member, he said, Wade, there's not a Republican way to fill the pothole. There's not a Democratic way to fill the pothole. There's a right way and a wrong way. And how do we work together to do things the right way? That's what the Bello administration has been about. And my God, we were tested by the coronavirus-19 pandemic. But Mike and Adam have led us in understanding how do we respond in the right way. And since a crisis is a terrible thing to waste, that's been my mantra since March of 2020, let me just note how incredible this county has been in using the experience of this global pandemic to make us a closer family, to build us as a stronger community, and to prove there is a role for Monroe County government in impacting all of our lives for the better. Mike and Rob talked about Mike's incredible work, and I won't belabor the point, but I'll just simply say I support the county executive's recommendation, and I am incredibly delighted to know that our government will work to make sure that Mike Mendoza remains a donut-worthy figure in our community. because of the incredible work that he's doing to prove that medicine is more than just prescriptions and clinical encounters. It's about healing, and it's about health. Thank you, Mike. Thank you, Adam. And friends, I'm going to yield the microphone to one of my dearest friends, Dr. Teresa Green, the president of our Board of Health here in Monroe County. Teresa is one of those people who actually make all the magic that I do actually occurs, because of the real hard work she does, bringing together community partners with data and with information to help us build wisdom. Teresa?
Thanks, Wade. That was lovely. Good afternoon, everybody. As president of the Monroe County Board of Health, I am honored to be here today for this announcement. Before coming to Rochester, I worked in local public health in Michigan. So I have experienced a variety of public health leadership, from the perspective of an employee of a local county health department, as a citizen, as a community leader, and now from the perspective of a board member. I assure you, Dr. Mendoza is among the very best of that leadership. It should come as no surprise to anyone that he is being appointed to a second term as Monroe County Public Health Commissioner, pending the legislative approval. As the speakers before me have made clear, our community was so fortunate to have Dr. Mendoza at the helm during COVID-19. He was alarmed when he needed to be, but also the voice of reason among times of chaos and unknown all around us, and always with a calming presence and armed with the most up-to-date information and knowledge. Most impressive to me was that even during the height of the pandemic, Dr. Mendoza took time to assure the Board of Health was informed and to solicit our feedback, not only on issues related to COVID, but on all the other things happening in the health department that didn't just stop because of the pandemic, including addressing addiction with the impact team and maternal and child health supports that continued. Dr. Mendoza is incredibly personable and so generous with his time, speaking annually for public health lectures at the medical center and meeting with students, particularly my medical students, whenever he can, despite his busy schedule. This is a true testament to his prioritization of transparency and communication and his commitment to the long-term health of our community. I have every confidence that Dr. Mendoza is the leader we need to address the aftermath of the pandemic, as well as the many other public health issues we face in Monroe County. Thank you, County Executive Bello, for your decision to reappoint Dr. Mendoza, and thank you, Mike, Dr. Mendoza, for your outstanding service to our community. On behalf of the board, I look forward to our ongoing work together. So I'd like to pass it back to County Executive Bello at this time. Thank you.
Thank you, Dr. Green. And I want to thank all of our speakers here today for those wonderful words about Dr. Mendoza. And you know, one thought I have, and then I'm going to pass the microphone again, too, is what's interesting here is that, you know, oftentimes I think Rochester and Monroe County has a history of fragmentation, people working in silos. We have two real large healthcare systems, you know, they're working side by side. We have school districts working side by side. We have nonprofit community. We have different worlds all working next to each other. They're cooperating, I guess, but they're not really collaborating, and we have a long history of that. What you see here under Dr. Mendoza's leadership, and you know, I think what happens sometimes it's forced to happen because of a crisis, but I think it also happens because your leadership rises to the occasion, and that's what happened here in our health leadership, is that those silos broke down, and we have organizations, public, private, that are now all standing together with one voice, acknowledging what the challenges are in the community and pledging to work together to lift up and solve those challenges and make a real impact in people's lives. Because as what Wade Norwood said, this is beyond prescriptions, it's beyond medicine. But we're all doing what people in government all over do. It's about people. This is about helping people and making an impact in people's lives. And that's what this is. And so that's why this is a no-brainer to renominate, and for me, for the first time, to be able to nominate Mike Mendoza as the Commissioner of the Department of Public Health. He's someone I've learned to trust. You always need to have trust with your doctor. He's somebody who cares about this community. And as one of the speakers said, what you see is what you get. He's the same person behind the scenes as he is on TV. Calm, methodical, knowledgeable, and really deeply cares about the health and safety of this community. So ladies and gentlemen, it's my pleasure to present Dr. Michael Mendoza.
Thank you, County Executive Bello, Dr. Apostolakis, Dr. Mayo, Mr. Norwood, and Dr. Green. You just heard me being compared to a donut, Waldo. But the one I like the most is Josh Allen. Not because he's a great quarterback, perhaps the future Super Bowl MVP, but because he got told today that he gets to have a day off on the first day of the preseason. So, Adam, I want you to remember that even Josh Allen gets a day off. But no, in all seriousness, I am humbled by your words. I am so very excited to accept this second appointment to be your Commissioner of Public Health. When I started as Commissioner 6 years ago, the Public Health Department had been without consistent leadership for a long time. At the time, I was the second interim commissioner in as many years, stepping in to fill a gap, all at a time when the opioid crisis was still in its infancy, and when few people valued, much less recognized, that we had a health department here in Monroe County. As you can imagine, this period of turmoil was uncertain and difficult for my team at the health department. When I had my first meetings with my division leaders, the theme was consistent. We needed to keep the health department afloat. Nothing about thriving or growing, very little hope at tackling anything beyond what was already in an existing grant or what was required by the state. It was then when I realized that this community deserved so much more. So I chose to stay on, grateful for the trust that then County Executive Dinolfo had placed in my leadership and vision at a time when we needed it the most to rebuild the health department. And so that was my first order of business. Rebuild the capacity of the health department through investments in training, efficiency, technology, and teamwork. I initiated cross-training programs for our restaurant inspectors, positioning them not only as enforcers of sanitary code, but also as educators and advocates to prevent foodborne illness and occupational hazards. I created the Division of Maternal and Child Health, a real and symbolic step to elevate early childhood development, nutrition, nurse home visitation for first-time moms, and the primary care for children in the foster care system. As the opioid crisis grew, we developed overdose prevention education and outreach programs, distributing hundreds of vials of Narcan to the community, giving presentations in nearly every school district in this county. And as you heard, we've since created the first ever Office of Addiction Services. And as my team back at the office well knows, we invested heavily in technology to improve efficiency and to get rid of paper. As County Executive Bello noted, public health is critical to our quality of life, our ability to live and work and play in Monroe County. As I see it, in Monroe County, we don't have red health, we don't have blue health, we have public health. Driven by science and data whenever possible, supported by sound clinical judgment, and engaging with our community with a special eye toward those who we have often overlooked. Because public health affects so many sectors of our lives, I wanted to make sure our department was ready for literally anything, and that anything came in 2020. A global pandemic that impacted the lives of just about everybody on the planet, and most especially my dedicated colleagues back at the office, who many didn't then and still don't know as well as I believe you should. My team did not work from home. The words remote work were never uttered for months back at the office. Many of us rarely went home nearly as much as we needed to. My team was the first responder to this public health crisis. We did not know everything that we needed to know about this novel virus, but we had to make sure we were on top of everything that we could be, because we owed it to our community to report and be transparent as things changed daily, if not hourly. They worked so effectively to reach populations that we have historically not been effective in reaching. We needed to help arm every resident in this county with the knowledge that we could, the best knowledge that we could at the time, to make the best decisions that we could at the time. And unfortunately, we did not have all the systems in place to collect data, distribute vaccines, or simply answer everybody's questions. And as the county executive has often said, we needed to fly the plane and build it at the same time. And we could not have done any of these things alone. This public health crisis was far too large. It required us to forge new partnerships and collaborate in new ways across this community. That is why I'm not only humbled by the comments of County Executive Bello and others here today, but I am motivated by the potential that these words represent. 6 years ago, I entered this job initially uncertain about my commitment to the first 6 years. Today, I look ahead very committed to navigating the uncertainty of the next 6 years. COVID and now monkeypox have laid bare the vulnerabilities in our healthcare, social services, and public health systems. The last 2 years have also reopened the wounds of violence, racism, and disinformation that will require all of us to come together to heal. If there is a silver lining in this pandemic, it is this. We have learned the necessity of working together to address serious public health concerns. The partnerships that we have formed with healthcare, education, businesses, nonprofits, representing different religions, genders, ethnicities, and many other people in our community, these collaborations will need to extend well beyond COVID to these very important public health issues. Not only do we need to maintain what we have built, but we will need to grow our work in environmental health, mental health, climate change, suicide prevention, and interpersonal violence. And those are just a few of the issues that we can see right now. And as we know, we also need to be prepared for what we don't see. And if our experience with COVID has taught us anything, it showed us that we are in fact ready as long as we work together and as long as we care for one another. So again, thank you to my colleagues here on stage. Again, thank you to County Executive Bello. It has been my honor to serve alongside you and your extraordinary team throughout the 13 years that I have aged since you took office in 2020. Seriously though, I am grateful for your friendship, your partnership, your support, and I'm hopeful also for the legislature's confirmation of your reappointment. Finally, to our colleagues in the media, thank you for being among the unsung heroes in public health. Your professionalism, your insight, your genuine desire to serve this community often goes overlooked. And so I especially want to recognize you and your colleagues here today. And finally, to the public, thank you for your patience and your support. Serving you is the reason I am here today and is the reason why I want to be here next year and beyond. Thank you.
Okay, thank you. And with that, I think anybody up here could take any questions the media might have. That's pretty comprehensive. Awesome. Thank you so much. Thank you. Yeah. I do not, no. So we submitted the, well, I hope not. I submitted the referral to re-nominate Dr. Mendoza was submitted this week and should be acted on by the county legislature in September. His current term expires at the end of this year, but needs to be done right now so that it could follow New York State, has some guidelines as well and some bureaucratic work that has to happen as well. So we need to make sure this happens right now. Yep.
I guess on the face of it, it's easy to say that I'm the person on the hot seat, but the reality is that, you know, I stand there on the shoulders of an entire department. And so for all those days, I think to myself, well, I really better get this right. I really needed to get it right first with my team. And that's what gives me the confidence to go before cameras and say what I say to the public. And so I challenge my team to challenge me, because if I can pass muster with my team, then I feel like I could talk to the public.
Great. Thank you, everyone. Appreciate it. Thank you.